Let's continue talking about COVID-19. The South African Federation of Trade Unions, that is Saftu, has accused government of a lack of progress in the COVID-19 vaccine rollout. It says because 2 doses of the Pfizer vaccine are required, the process is incomplete. According to the Department of Health's latest report, 870,477 people have received their first Pfizer dose since the phase 2 rollout started on the 17th of May. Police unions are now saying they would have expected that the South African president and the management of the SAPS and DCS, the Department of Correctional Services, would have ensured that the vaccination of its members would have been a top priority. To speak more about this, Peter Ntsime Sapu, Acting Deputy General Secretary, and Richard Mamabolo is a Popcru spokesperson. A very good evening to you both, and thank you so much for speaking to us. So let me just first start with you, Mr. Ntsime. What is the latest that you're hearing from the police department, that you're hearing from the Department of Corrections on the vaccination rollout for law enforcement officers?
Good evening, and good evening to your viewers. Look, the challenge that we're having is that we have raised this matter before with the management of the police, DCS and transport with regard to the vaccination. We knew as early as last year that the 3rd wave is on the way. We are much aware that we need to prioritize the issue of the vaccination of our members. You must remember that last year when the president did a lockdown or announced a lockdown, our members were were announced as frontline workers. They were the one who have to go and face the invisible enemy. Currently, when this rollout have to be implemented, now the department, they are lacking, they are now on the snail pace. They are not intending to prioritize our members, which is a worrying factor because most of our members are dying, most of our members are infected, most of our members are lying in hospital. That is why we have called all this department to come on board and to make sure that we prioritize the issue of vaccination of our members, particularly to the side. Police officers, we know where they are based. We can always go to the police station. Correctional services, we can always go to the correctional facilities and make sure that we do the rollout in those facilities.
Okay. Now, we'll get to the actual figures of how many of your members have been affected and overall within the sector. Mr. Mamabolo, as Sapu, you've also reacted to what Saftu is saying, emphasizing that PPE equipment should be top priority for police and that you've also been met by silence from the concerned departments. Why do you say this? Have you tried to engage them? Have they been stonewalling you?
Thank you and good evening to your viewers. We are quite, in fact, I think the first point is that we're quite happy that just last week we had reached a 1 million mark of vaccinations rollout. And of course, I think our target being 40 million to ensure that we reach herd immunity is going to be quite a huge task for frontline workers, especially now that we're entering into the 3rd wave. You know, it means there'll be more people who need hospitalization. It would mean that our members need to work more in larger numbers in ensuring that we obviously suppress the spread of the virus. And I think considering the fact that when the pandemic arrived in the country, there wasn't much information about it, but we have seen obviously a large number of our workers within the criminal justice cluster being infected. And of course, we've had so far 29,000 police officers being infected and obviously 600 dying. Now, this has been happening as well within the Department of Correctional Services. Now, our plea is that we need to obviously be more prepared this time around. We do sit within steering committees, both within the DCS and the SAPS. And of course, we can definitely say that currently the SAPS does have a rollout plan. However, engagements have obviously been communicated with the Department of Health in ensuring that the matter is prioritized. We know up to now there has not been a response. So we fear that if this is not something which is responded to urgently, it will create challenges. I mean, part of what the intervention of the president was to ensure that the they pardoned about 19,000 inmates within our correctional centers. Part of that was to ensure that we reduce the levels, the possibilities of infection. Now, going into the third wave and not having vaccinated these essential workers would obviously create a risk where the numbers would go up in the coming months.
Okay. Mr. Ntsime, it was said a record number of SAPS and DCS employees died as a result of COVID-19. We've just heard from Mr. Mamabolo on the number of evictions. I think he said 29,000. So can you bring us up to speed about COVID-19 related deaths within your sector this year and in the past year? Have you had figures that you can just say, this is exactly why we're motivating, that we are on the front lines, and please just don't gamble with our lives, as you've been saying?
Indeed, you need to understand one thing for sure, that police officers, correctional officers, traffic officers are frontline workers. That one is a fact. And then every time when they have to work, they have to go outside there, whether it's during the day or in the evening, they are working. And these members, as I speak with you, the numbers that you hear here are increasing. There is a third wave that is taking place currently. We see most of our members being affected. We see most of the police stations being closed on a daily basis. We have engaged the management of both the DCS and the police to look into the best way in terms of making sure that the vaccination sites are available. The rollout plan that we're talking about, the plan is there. But like we're saying as the South African Police Union, we knew about the third wave as early as last year. We knew that it's going to be third wave by June this year. So we expected the government to at least really prioritize the issue of members of the police, all the justice cluster, to make sure that by now, at least most of our members are vaccinated. Remember that if these members are not at work, if these members are ill, you are not going to have, there won't be any stability in the country, because people have to know that police officers are nowhere to be found as a result of them being hospitalized, or some of them have succumbed to this virus.
Mr. Mamabolo, vaccination is obviously the last port of call. It is not a silver bullet to ensuring that one is unaffected or not infected with COVID-19. So if we could just reflect back on what led us to this point, what can you tell us, as both unions, I'll start with you, Mr. Mamabolo, first, about the reports around the SAPS confidential risk-based and compliance draft internal audit report, which found that something like 1.6 billion rand in irregular personal equipment procurements was incurred at the SAPS. Has anyone been held accountable? Does this mean that police are also without PPE while also not being vaccinated?
Look, as far as we know, of course, we've been participating within the steering committees that had been established at the beginning of the pandemic. So we obviously learned about the amounts that you speak of in recent times. And of course, we hope that investigations are concluded as soon as possible. But as well, it has obviously been a challenge wherein you get reports from some stations wherein the PPE facilities are not fully available from time to time. But we must say that the conditions have improved since the past year. So we're expecting that with this, with the continuation of ensuring that PPEs are available, the process of vaccination rollout would obviously as well add value towards ensuring that we do have sufficient capacity to actually reach the goal of attaining about, the herd immunity of 40 million, as we currently stand at 1.5%. So it is quite a worrying issue that there are certain funds which are obviously missing, which could have obviously been used in ensuring that we build sufficient capacity for the coming challenges of the third wave.
Thank you so much to you both. Unfortunately, we have run out of time. That there was Peter Ntsime, Acting Deputy General Secretary of the South African Police Union, and Popcru spokesperson Richard Mamabolo. The African